Shira, can you give us a concrete example of one of the places where the Israeli data systems were really at their best and really made a unique contribution?
There was a series of New England Journal articles that came out right after the COVID vaccine came out. It was really impressive what Israel was able to do, and they published multiple articles in the New England Journal based on Israeli data sets where they were able to look and gather data, and they had prospective data that people who were vaccinated and then whether or not they tested positive for COVID, whether or not they were hospitalized, whether or not they died, and they had all of their demographic and comorbidity data as well. So they were able to do subpopulation analyses. Does the people with diabetes, is the COVID vaccine effective in them? And they knew what neighborhood they lived in, and they knew whether they were Arab or Haredi, and they had all of this population data. Whereas in the US, in order to collect that data, you need to ask about it and you need to find out, well, we didn't ask this or we don't know. And when people get tested, it's not necessarily in the same system. And if they're hospitalized, it's not necessarily in the same system. And this way in Israel, they had all of their comorbidities, all of their demographics, and all of their medical data in a single data set for 1 million people.
Amazing. Thanks. That was a great story.